Minister Dr Zweli Mkhize is worried about the rising number of COVID-19 cases in KwaZulu-Natal at the moment. Mkhize says the province seems to be following the same trend as the Western Cape, the Eastern Cape and Gauteng in terms of infections. Well, let's talk about KZN's readiness now for the peak with Premier Sihle Zikalala. Premier, very good morning and thanks for your time. Now, you've said that you're officially in the eye of the storm. Are you prepared in KZN for this?
Yes, we can say that unfortunately we are now facing the storm. It's here with us, but we are ready and prepared. Right now we've got more than 16,000 beds that we have reserved for assisting those who will be infected as numbers are escalating. We are encouraging people to come forward once they have tested positive. Let them come for self-isolation in government facilities, as that will help us to monitor them and ensure that they follow protocols. But also those who cannot self-quarantine, we can also do quarantine. So the capacity in terms of beds is enough. We are working with the national government to ensure that we address the issue of oxygen and all other necessary material and equipment that is needed.
Well, Premier, you also seem to be quite concerned about people who are coming in for treatment too late and also those who are relying on alternative treatments. What are you observing there? What's happening with patients in terms of that?
We are not against the use of alternative medicine or treatment, but our main concern is when people would come to health facilities too late, when we see that the virus cannot be reversed at all. Now, we would like people to come early so that they are able to get the treatment on time, rather than to come, because there's a number of cases where people come only when it is too late for them to be saved.
In terms of your hotspots, what can you tell us about where you've identified so far, where you need to sort of put more effort into identifying and treating?
So far, our hotspots is still within eThekwini district as the first, but the second is Umgungundlovu. And in the recent period, we've seen the rise of numbers in King Cetshwayo, which is Richards Bay and surroundings, as well as Amajuba, which is Newcastle. But all areas are affected, but it then depends on the magnitude, where you get other areas having high numbers with others with less numbers.
All right, Premier, we're also hearing some disturbing news coming through about just what's happening at public hospitals there. Just chatting to somebody who I know works at Addington Hospital, saying that public hospitals have been told now that they are responsible for sanitizing, that the health department will not be sanitizing those facilities. Is that true? And what's the reasoning behind that? And the reason we're hearing is that there is no money for this anymore.
No, we don't have such reports, but because it has been raised, we will follow it. As government, we are sanitizing all health facilities on regular basis, and we take that as our responsibility. It is the responsibility of the department, and we'll continue to do so. With a specific case of Addington, we will have to follow it and ensure that it is corrected.
All right. And in terms of this entire PPE saga and the controversy over that, we know that there are investigations ongoing as well in KZN, in addition to other provinces. Just how are you handling that? And what can you tell us about that at the moment in terms of irregularities when it comes to those tenders in your province?
Well, we have started investigating all areas where there have been reports and allegations. And we presented a report last week in few areas, especially the social development. And we're not going to tolerate any kind of abuse or corruption. We're going to ensure that those who are involved are disciplined, but further prosecuted. So any department that is involved, irrespective of who, we will ensure that fair disciplinary actions, investigation, disciplinary actions, and prosecution take place.
All right, Premier Sihle Zikalala, thank you so much for your time. I understand you're rushing off to a meeting, so we'll let you go now.